Well, we have a warning for parents this morning involving children ingesting edibles. And this morning we have Julie Weber. She is joining us, the director of the Missouri Poison Center. She's also with SSM Health Cardinal Glennon. Good morning to you.
Good morning.
Yeah, so we're talking about these skyrocketing cases. How many are we talking about?
Boy, in Missouri, we've gone from just 3 cases in 2016 to over 57 cases now in 2021. So it's just really, really growing.
I guess with recreational marijuana being approved in many states, including in Illinois here in 2020, that's maybe one of the reasons we're seeing more of these, and because they look so similar to candy.
Yes, really the edibles look like brownies. They look exactly like gummy bears, gummy worms, and children don't know the difference. It's this age group from 0 to 5 who can't read the packaging, and it looks like something good to eat, and the product's accessible to them, and they get into it.
Yeah, so the parents call and say, my child has eaten this. What do I do?
Exactly. Sometimes they don't even know initially, and it's symptoms that the child's having of being really tired or laying around or stumbling. And then they find the packaging. And then that's where we really have to start asking a lot of questions to really decide if we can safely watch them at home. But in most cases, unfortunately, we're having to refer them into the emergency department.
Yeah, and some of those side effects you say could, on the worst case scenario, lead to trouble breathing and even a seizure.
Correct. These products, usually you think one has what they're saying is a normal serving of 5 to 10 milligrams, but they're eating sometimes up to 12 or more of these products, and we're talking a gram of marijuana, which can definitely lead to a seizure, or unfortunately some children being intubated on a ventilator to help them breathe.
What can parents do?
Really, the biggest thing is to get the products out of the children's sight and locked up and not in their access. That is the biggest thing, is the accessibility with more of these products in the home, and it really can fool them and they can get into it.
Yeah, Julie, what age are we talking about that you're seeing most cases?
Most cases are under 5, and that's usually, again, because they cannot read the packaging, but the packaging isn't always clear, and the kids are hungry and sometimes not as well attended, and they get into something that they shouldn't be.
Yeah, I mean, maybe this is something, I guess to be brought up with some of these companies, I believe some states have, is to change the packaging.
Definitely.
Yeah.
Some of the packaging, it really does make a difference. Even like just a rip open packaging versus sometimes those child resistant containers are just something that has a definite difference than looking like a candy that we eat.
If a parent thinks their child has eaten something, what should they do immediately?
What we say to do is immediately call the Poison Center. Within seconds, you'll be speaking with a nurse or pharmacist who's specially trained in this, and we can help decide if we're able to keep them at home or refer them into the hospital and get them the best help.
Okay, Julie, while we have you in, we also wanted to mention a Facebook event that you guys have coming up on Friday. This isn't dealing with edibles, but something actually more deadly for children, fentanyl.
Right. We're really wanting to bring awareness to the risk in preventing all these fentanyl deaths that have been happening. In St. Louis City and County, the cases are increasing. And we have an excellent expert panel that's going to be available live at Mo Poison Center on our Facebook page to really talk about this. We have people from Cardinal Glennon Hospital, a physician, St. Louis Children's, the police department, myself at the Poison Center, and we're really, and also the Department of Health, and we're really going to be able to bring home messages that help prevent this. It's just that residue, and just such small amounts of fentanyl can lead to a fatality.
Absolutely. That's 10 a.m. on Friday, and we'll have more information as well on our website.
Excellent.
Julie Weber, thank you so much. We appreciate it.
Thank you.
All right, so for more information on that and also on ingesting edibles, just go to stlmoms.com.